Hi, my name is Chase McLeod. My presentation's on TPA and the importance of a stroke. So to begin with, the importance of a stroke, it's a serious medical condition with significant impact on your brain and overall health. So it occurs when blood flow to the brain is interrupted, depriving brain cells of oxygen and other nutrients that it needs. Symptoms that you would get would be weakness or numbness on one side of the body, difficulty speaking or understanding speech, vision problems, permanent brain damage or death, or early intervention can even minimize damage and improve recovery chances. So the main reason I kind of chose this picture from the CDC is that it kind of just shows a good demonstration of what was spoken over here. So it shows you the death of brain tissue, how it kind of happens right there, how it could be a blocked artery or ruptured artery, and how it affects it overall. So the types of strokes, two main types of strokes that I was able to research about, and it was ischemic and hemorrhagic. So ischemic strokes account for 87% of all strokes. It occurs when a blood vessel is supplying blood to the brain and is blocked by a clot. The hemorrhagic strokes occur when blood vessels in the brain ruptures, so it causes bleeding within the brain and can lead to severe brain damage or death. And so the picture I kind of showed here shows, in my opinion, a great example. So it shows like ischemic, how it kind of looks like a blockage right here where you can kind of see the red and black. And obviously, as you see how it's pretty much, the black just pretty much means that blood is not circulating through the brain. And then it shows over here how it's a rupture of the blood vessels and how that affects it. And so I kind of just put a note in there that both types of the strokes can be caused by several different risk factors, including high blood pressure, smoking, diabetes, and high cholesterol. However, there are also some modifiable risks like sedentary style, like your lifestyle of how you live, unhealthy diet, and excessive alcohol that could lead to it as well. So overall, what is TPA? TPA is clot busting drug that works by breaking down the clot that's blocking the blood vessel, restoring blood flow to the brain. It activates plasminogen. That's a protein that helps to dissolve a clot and clear the blockage from the blood vessel. Typically given to the patients as an injection into the vein. Most effective when administered within 3 hours of the onset of stroke symptoms. My apologies. Cannot speak today. So anyway, I kind of just showed this picture to show kind of what the bottle looks like. This is what you would be prescribed. And as a note, I pretty much was just talking about how TPA is not suitable for all patients and that there are certain risks associated with the use. An example I have is that TPA may increase the risk of bleeding in the brain. So it's not like recommended for all patients who have a history of bleeding disorders or who have recently had surgery or head injuries. So, and additionally, TPA may not be as effective in patients who have had stroke caused by a large clot or in patients who have had a stroke caused by bleeding in the brain. So the first line of defense is that this pretty much occurs when blood clots blocks the flow of the brain. Got that already. So the first line of defense is aspirin. If aspirin is not effective, then you go with the TPA. And, like again, TPA is a clot busting drug administered within 3 hours of a stroke system, and then also carries risks. So also remember that. So overall, in summary, aspirin is like the main first line of defense for the ischemic strokes. But if it's not effective, the FDA approved drug, the only FDA approved drug to treat ischemic stroke is TPA, which is the clot busting drug. And so that's the first line of defense. So just a summary of what I went over today. So that strokes occur when blood flow to a certain part of the brain is interrupted, depriving brain cells of oxygen and nutrients. The two main types are ischemic and hemorrhagic. The first line of defense for ischemic is aspirin and over-the-counter anti-inflammatory agents. If aspirin is not effective, the FDA-approved drug is the ischemic strokes is TPA. TPA is, the clot busting drug, clot busting drug that works by breaking down the clots. Um, TPA also activates plasminogen, a protein in the body that helps to dissolve the clot and clear the blocked blood vessels. It's most effective when administered 3 hours and carries risk, not recommended for all patients. And these are my references. Thank you all again for listening.